and preserving dentistry's integrity, why rejecting resolutions 404 and 407 matters. Editorial, October 18, 2024. Written by Bob D., narrated by Paula AI at 1.2x speed. Too long didn't read TLDR. Critics argue that the ADA supports a licensure compact that prioritizes corporate dental entities, like DSOs and insurance companies, over individual practitioners and patient safety. The compact lowers professional standards, and when combined with a licensure exam that lacks a hand skills test, specifically the ADA-created DLOSCE, it potentially benefits large corporations at the expense of the dental profession. Resolutions 404 and 407, if passed, could further entrench corporate control within the ADA and jeopardize the integrity of dental education and licensure. Delegates are urged to reject these resolutions in their current form to protect the profession's standards and patient care. When critics claim that the ADA is in the pockets of insurance companies and DSOs, they don't mean it literally. Instead, they refer to actions that seem to benefit these entities over dues-paying members and the public, whether intentionally or not. For example, the ADA's support of a specific licensure compact appears to aid corporate dental entities by making it easier to move dentists across states, benefiting large organizations more than individual practitioners. Additionally, the NCOIL agreement seems to favor insurance companies by obstructing many states' efforts to implement a meaningful dental loss ratio, which could provide better patient protection and greater transparency in insurance practices. These actions, whether intentional or inadvertent, appear to prioritize corporate interests over those of dentists and the public they serve. What's up with Resolution 404? The American Dental Association, ADA, has been advocating for a dentist licensure compact, an agreement between states aimed at reducing bureaucracy and facilitating the movement of dentists from one state to another. While this concept has been a goal for many dentists for years and seems beneficial in promoting freedom of movement for dental professionals, several concerns arise about the specific compact supported by the ADA. The crucial question remains, at what cost? One major issue is that the standards set by the ADA-supported compact do not align with the expectations of many in the dental profession. These standards resemble those used for beauticians rather than the rigorous criteria set by the Federation of State Medical Boards, FSMB, for physicians. This inconsistency has raised doubts about whether the compact truly serves the profession's interests or if it primarily benefits dental support organizations, DSOs, making it easier for them to move dentists across states and hire individuals who might otherwise struggle to obtain licensure. An alternative compact, supported by the American Association of Dental Boards, AADB, aligns more closely with FSMB standards and has broader support within the dental community. Last year, the ADA's attempt to pass its version of the compact was unsuccessful, as the House of Delegates referred it back to the Council on Dental Education and Licensure, CDEL, for further consideration. However, the ADA is now trying to include this compact as part of a broader resolution, Resolution 404, rather than allowing it to be debated and voted on separately. There are calls to separate this compact from Resolution 404, giving it its own standalone resolution so it can be openly discussed and voted on by the House of Delegates. If this separation cannot happen in time, we believe the resolution should be rejected outright. Concerns about the ADA-supported compact extend beyond its standards. A significant issue involves the ADA's creation of its own licensure exam, the Dental Licensure Objective Structured Clinical Examination, DLOSCE, which does not require a hand skills test. We believe a hand skills test is necessary due to inconsistencies observed in dental education today. While there are many dental schools providing adequate to excellent education, reports from young graduates also show that some schools are not adequately preparing students to be competent and capable clinicians. This makes the hand skills test a necessity rather than a nuisance. Every other existing licensure exam includes a hand skills component to ensure that dentists possess the practical abilities needed to protect public health. Was this element intentionally omitted to attract more candidates to this exam? By pushing this specific compact in combination with a licensure test that lacks the essential hand skills assessment, the ADA risks lowering professional standards to potentially dangerous levels while seemingly benefiting large corporations. This not only helps DSOs gain an unfair advantage over private practices, but also allows the ADA to increase non-dues revenue. We oppose this type of revenue increase because it can erode accountability to members and the profession. Live patient exams, a point of ethical concern for many, are no longer required by any licensing board. While licensing portability and freedom of movement for dentists are positive goals, they should not come at the cost of compromising patient care or the profession's integrity. Allowing dentists to move between states without a proper hands-on skills assessment undermines public trust and may ultimately benefit large corporate entities like DSOs at the expense of individual practitioners. But wait, Here comes Resolution 407. The Council on Dental Education and Licensure (CDEL) consists of ADA members appointed by the Board of Trustees and representatives from other organizations, all ADA members, involved in testing and licensure. Some of these organizations are long established and are experts in this area. Resolution 407 seeks to silence those voices. You might think, what's wrong with that? We want our ADA to have the final say, right? Wrong. This resolution would become policy, meaning it would operate independently of who sits on the Board of Trustees or the House of Delegates, further entrenching its influence over time. Once set as policy, members of the Council on Dental Education and Licensure (CDEL) could potentially be chosen only from those who do not dissent. If only the ADA controls this council, there will be no objections to what they push through as the standard for testing and licensure, unlike how it has always been. With increasing influence from DSOs, insurance companies, and organizations like the Association of Dental Support Organizations, ADSO, in the ADA and dental education, this control could skew dental training standards in favor of corporate interests rather than patient and practitioner needs. Historically, DSOs have catered to a population segment less concerned with seeing the same dentist consistently. However, the ADA's current actions suggest a shift in power dynamics. If DSOs gain more control over the dental workforce and training standards, it could lead to a market imbalance where insurance companies and corporate dental chains hold the upper hand, leaving individual practitioners at a disadvantage. We believe the ADA-supported compact and the accompanying resolutions require careful scrutiny to ensure they do not inadvertently favor corporate interests over the profession's integrity and patient safety. The compact should be evaluated on its own merits, with a focus on maintaining high standards in dental licensure and ensuring that any changes genuinely benefit the dental profession and the public. For now, Resolutions 404 and 407 must be defeated. If you're a delegate and have any questions, please contact me. Black Giraffe.